Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds. These weekly sessions serve as dynamic platforms for learning, discussion, and collaboration. We focus on the co-creation of knowledge through the Learn One, Do One, Teach One approach. This method ensures that each participant not only learns valuable health information, but also applies it and teaches it to others, fostering a ripple effect of empowerment and education. By participating in the Actuate Health Access Program, individuals gain the tools and knowledge needed to improve their health and the health of their communities. Our goal is to create a network of informed and proactive health custodians who can address health challenges in a sustainable and impactful way. Join us in this journey towards better health for all. Together, we can make a difference. Welcome to the Actuate Health Access Faucet, a transformative initiative dedicated to empowering individuals through the principles of sustainable One Health. This program recognizes the deep interconnectedness of animal, environmental, and human health, affirming that a holistic approach is key to well-being. Our program is designed to equip individuals with essential health knowledge, enabling them to become custodians of their own well-being. Through our hybrid Learn-to-Earn sessions, conducted both virtually via Google Meet and at physical locations, we engage participants from diverse backgrounds.
Good evening. Hey there. Hello, Frida. Can you hear me?
Yes, Glory, we can hear you.
Uh, Good evening, everyone. I hope everyone is okay, and welcome to our today's health access session. Um, as usual, it's it's one of our empowering shows for this program, where we um empower our learners to, as you have heard in the video, to learn to be custodians of their own health, because that's the only way we can promote health. Yeah, so over the last few sessions, we have been exploring how we can utilize our own token, the Actuate token, because to make healthcare services accessible, affordable to all, because we realized that one of the major obstacles um, people experience as they try to get quality healthcare services is financial barriers. And we have looked at all ways and realized that the traditional funding models are not um, of help anymore, that we need to come up with innovative ways. And we came up with the best and a compelling, innovative, modern model, which is quadratic funding. And we realized that this quadratic funding, how are we going to implement it? And it's through blockchain. And of course, using now our own tool, our Actuate token. So that's where we are. So the few classes we discussed how we can use the Actuate token, the importance of Actuate token in health access. So we started right from the individual health, because health starts from within ourselves. And then we went to family health, and now today we are at community health. So our topic for today is the importance of um, Actuate token in community health. How can we promote community health, the overall health of the community, using our Actuate token? So before we start the discussion, let me take you through the meeting agenda. So we will start by topic presentation. And our topic master for today is Ronald Anthony. And then after our topic master present, we will get to hear additional comments about the topic from our very own CEO, Dr. Macharia Warwingi. And then after that, we will have an interactive session where you can ask questions, you can raise your concerns about the topic, you can contribute ideas. Let's share. I encourage you to engage during this session. And then after that, um the pre-Boston Nairobi Summit announcement from Augustine Narokwe, and then we will conclude the meeting. So I encourage all of you to be keen. Let's be curious. Let's listen, and at the end of it, let's get out from with something. So now allow me to welcome our topic master, Ronald. Ronald, Anthony, please confirm whether you can hear me.
I can hear you.
Okay, welcome. Go ahead.
Thank you so much. Our today's topic is the importance of the Actuate token in community health. The Actuate token is revolutionizing the landscape of community health by enabling more efficient, transparent, and inclusive health initiatives. As the world shifts towards decentralized model of governance and funding, Actuate token-based system provides a powerful tool to address the unique challenges faced in delivering healthcare, particularly in under-resourced communities. By combining blockchain technology with the health-focused initiatives, the Actuate token creates a decentralized ecosystem that enhances access to healthcare services, supports health-related projects, and fosters community empowerment. Decentralizing health resources with Actuate token. At the core of the Actuate token's value is its ability to decentralize health funding and decision-making. Traditional healthcare systems often face challenges such as bureaucracy, inefficiencies, and unequal distribution of resources. The Actuate token offers a solution by democratizing access to funds and enabling communities to have a direct say in how healthcare projects are managed and supported. Through the use of blockchain technology, the Actuate token ensures that health-related funds are distributed equitably and transparently. It also allows stakeholders, patients, healthcare workers, and local organizations to participate in decisions on how resources are allocated, ensuring that the most pressing needs are addressed. This decentralized approach promotes accountability and efficiency, ultimately leading to better health outcomes for the community. Funding community health projects. One of the key roles of the Actuate token is to fund health-related projects within the community. Whether it's improving access to clean water, expanding vaccination programs, or supporting mental health initiatives, the token system enables rapid and targeted funding to specific areas of need. Communities can propose projects through the Actuate platforms, and token holders can vote on which initiatives receive funding. This democratic process ensures that the projects receiving support are those that have the greatest impact on the health and well-being of the community. Additionally, since the funds are distributed on the blockchain, every transaction is transparent, allowing communities to track how the resources are being used and ensuring there is no misuse of funds. In areas with limited access to traditional healthcare, the Actuate token can support mobile clinics, telemedicine, and other innovative approaches that bring essential services directly to the people who need them most. Encouraging preventive health measures. Preventative health measures are often overlooked in many communities due to the lack of awareness or resources. The Actuate token initiatives insensitize individuals to adopt healthier lifestyles and engage in preventive health activities. By participating in the health education programs, attending wellness workshops, or undergoing regular health screening, community members can earn tokens as rewards. These tokens can be used to access healthcare services, purchase medical supplies, or contribute to local health projects. The token-based incentive system helps foster a proactive approach to health, shifting the focus from treatment to prevention. It also empowers individuals to take charge of their own well-being while simultaneously supporting the broader health goals of their community. Enhancing collaboration between health providers and communities. The health token promotes collaboration between healthcare providers, local organizations, and the communities they serve. Through token-based governance, healthcare providers can receive valuable feedback from the community, allowing them to tailor their services to better meet local health needs. For example, if a community identifies a gap in maternal healthcare services, they can propose a project to address it. Healthcare providers can collaborate with the community members to design and implement the initiative. With the funding and decision supported through the token system, this type of collaboration fosters trust between healthcare providers and the communities, resulting in more effective and sustainable health intervention. Moreover, the Actuate token allows for cross-sector collaboration, bringing together public health officials, non-governmental organizations, NGO, and private enterprises to work towards common health goals. By aligning interests and resources, the token system can drive significant improvements in health outcomes, promoting transparency and accountability in health services. One of the key benefits of using blockchain technology in the Actuate token system is the level of transparency it offers. Every transaction, decision, and allocation of resources is recorded on the blockchain, which ensures that all stakeholders have a clear view of how health projects are progressing and how funds are being spent. This transparency helps to build trust within the community and encourages more individuals and organizations to participate in the ecosystem. By reducing the potential for corruption or mismanagement, the Actuate token fosters an environment where health resources are used effectively and where community members can hold decision makers accountable. In regions where healthcare systems have been plagued by inefficiency or a lack of oversight, this transparency is especially valuable. It ensures that health services are delivered in a fair and efficient manner, ultimately improving access to care and enhancing overall health community. In conclusion, the Actuate token represents a transformative tool in the quest to improve community health. By decentralizing health funding, empowering communities, promoting preventative measures, and fostering collaboration, the token system creates an ecosystem that can address the unique health challenges faced by underserved populations. With the transparency and accountability at its core, the Actuate token not only enhances access to healthcare services, but also ensures that health-related resources are used in the most effective and equitable way possible. As healthcare systems continue to evolve, the Actuate token serves as a beacon of innovation, demonstrating the potential of blockchain technology to drive meaningful improvements in community health worldwide. Thank you, and that's the end of my presentation.
Thank you so much, Ronald, for that comprehensive presentation. Now I will welcome Dr. Macharia to give additional remarks. Dr. Ari, You're welcome.
Yes. Hello, can you hear me? Okay. Tell me whether
Yes, we can
I'm
hear
audible.
you.
Oh,
We can
that's
hear you,
great.
Dr. Karen.
All right. Thank you so much, Glory. Now, again, we come back to health access at community. And thank you so much, Ronald Anthony. Ronald Anthony, you are the greatest orator. Wow, you teach very well. So I think we got greatest orator, great teacher, Ronald Anthony. I love your work. And because you are teaching me a lot of things myself, can you believe that? So, and then you're teaching a lot of people. So I think let us all appreciate Ronald Anthony for just breaking down this complex topic line by line for us and speaking about it graciously. See, it's all the gracefulness that will help us understand what this is all about. So today we are Actuate Token Ed Community. And how we are saying, how do we use Actuate Token to produce health of communities? Yeah, the word community is confusing, was confusing to me because long time ago, I used to think community people is villagers, like community people in the village. So I was confusing villagers with community. That's my confusion. And it's later understood that community is any gathering of people. Whenever there are more than a few people together, they form a community because then this community is gathering of families. Families are people of the same genetic components. So when you combine them, they make a community. So when you think about community from now the social perspective, you're thinking about the families, many families together, living in one geographical location. That's the idea, geographical location, be forming a regional community. That's the regional geographic region. But guess what? Communities are not geographical location. And communities are not just people living together in one area. Community is a word that it encompasses everything. For example, if you have medical practitioners, doctors, you can have community of doctors. They call each other colleagues. It's a community. And then they usually form professional organizations, such as Kenya Medical Association. So in the Kenya Medical Association, you have a community of doctors. So they have one thing in common for them. They are doctors, they are healthcare, they say they are health professionals. So you say health professional community. Similarly, you can have communities of other professions. Like you can have an engineering community, or you can have a, a nursing community, or you can have a community of teachers. See that? So community is not a community of people living together in one geographical location. You can have a community of people online, which is an online community. The people are linking together, say on LinkedIn, you have community on LinkedIn. Or we say in a WhatsApp group, if people in a WhatsApp group, and you have seen in WhatsApp, they have introduced something called community. So you just wonder what is community? There's a group of people, but you have, so that group is considered like one family. But if you have different groups, you have a community of groups. So community, it means that people who have got a common, you know the word communities come from common interests. People having common interest. What brings us together? So when you're talking about community health, or the health of communities, we are talking about how do we bring all these communities together? And see, until the blockchain came along, let's say the internet, first of all, the internet is able to build communities through Web 2, second web technologies, connecting people, like what Facebook did, building communities together. so that you can now build communities in a different way, except apart from the traditional communities that were defined by their geographic location. So when people are on Facebook, they're in a community or even when they're on WhatsApp, they're in a community. Because the word community comes from the word common, but in a common, people doing what? Communicating. It's about communication. See that? Communicating what? Communicating information. Now, communicating information is good, like what you have shared in Facebook and all that, in Web 2 technologies. But then there's much more profound level of communication, which Web 2 was never able to capture. It is communicating the value produced by every member in the community, communicating the value of every member in the community. That communicating value has only been possible, it may be made possible by the blockchain. It's like the Actuate token. So Actuate token is a symbol of communication of value. See? And traditionally, that symbol of communication of value, we call it money. So people have never understood really what is money. Money is not Kenya shilling or US dollar or the other, but money is a system of symbols and agreements. People we agree upon a system of symbols and agreements for communicating value to one another. Okay? So money is not US dollar or Kenya shilling. It's anything that you can use to communicate value to one another, or even to store that value so they can be communicated. So health problem arise from failure of the communication of value. When you cannot communicate value because you put too many words, obstacles in communication, like the way we have in traditional finance system. Censorship, refusing people to get into to have bank accounts, preventing others from sending money. Then communication of value collapses on itself. And when it collapses, people become sick, they become disabled, and then they die. Okay. Now, what the Actuate token has done is to take that thing away, where communication becomes is blocked by people thinking that other people should not communicate, or censorship of communication. Censorship of communication of value. So the blockchain removes the censorship of communication of value. So people now are able to communicate with one another and they can exchange value in a community. And so that is that's the real deal. Let's say, what is this, or what's cryptocurrency all about? Let's say, what's about blockchain itself, what it's all about. Because blockchain is censorship resistance. It is resistant to censorship. It is borderless or boundaryless, and it is immutable. See, that gives it a perfect symbol of communication. And so Actuate token is a perfect symbol of communication of value in a community. See, and then if people can communicate value, then people can actually sell or they produce, they can get paid for the work they produce. Value means what you do every day, so you get paid for it. If you work and then you're not paid, it means that your work goes to waste. And that is the problem of what's called third world. Third world is inhabited by people who work, but then they're not paid for their work. They can go and plant vegetables as much as they want, but then they cannot sell those vegetables, or even they can have cows, they can milk, but they're going to waste all the produce of their labor, which is known as post-harvest loss. And all that is what's called dead capital. So when it's dead capital, that value is not getting communicated in the community, people become poor, people become sick because of their poverty, we get disabled because of their sickness, and people die because of their disabilities. See? So it's a sequence. that we must stop that sequence because we have the technology to stop it, and that technology is what we call the Actuate token itself. That's the power. But now, how you bring it down to the level on the ground so people can understand it. People don't have to understand all that theory about money. It's a means of communication. All you have to do is tell them, have a wallet, like what we say, you create a wallet and then you receive tokens, and then that gives you access to the entire system. So what is going to be very powerful with Actuate token is that if you're in the token ecosystem, and what Anthony has told us, the token like this that is able to be held by people in different communities. If you're talking about different community of engineers, community of doctors, community of nurses, community of farmers, community of people in the villages, then you can have cross-sector communication or cross-sector collaboration. And that cross-sector collaboration is what is important in order for people to get paid for the value of the work that they produce. Okay, for the value of the product of labor. So that if somebody is in a village and needs to get healthcare, they can now use that token to pay for the healthcare services provided by through the hospital, by the doctors or nurses or other providers. So you can see that is cross-sectoral communication or cross-sector collaboration. And if say a doctor wants to install some technical devices, needs some engineers, this doctor can use the Actuate token to pay the engineers so they can come and help him. So that's again cross-sectoral collaboration. Then it means that in order for the Actuate token to work well, we have to bring all these professionals together into the Actuate ecosystem. That you have the engineers, the doctors, the teachers, and people in the community, everybody being in the ecosystem so that they can exchange their value. See, that's the power. And so that is why we are working very, very hard. Even you can see when you're producing the summit itself in December is highly multidisciplinary. When you go to the website and look at the list of speakers, those speakers are now speakers from one discipline. They're not speakers who are just engineers, speakers who are just pediatricians, or speakers who are just architects, but speakers from all walks of life. And that's why we are continuing to invite people to come to participate in this as speakers who are multidisciplinary. What makes us become unable to get off the ground is because when people create a meeting, an event like this, like the summit in December, if they are doctors, they invite only doctors to come. If they're architects, they invite only architects to come to the meeting, to the event. So you have doctors having their own private events for doctors. You say that's for doctors only. So if you're an engineer, you can't go there. If you're an architect, you also can't go there. And for architects, they are going to create their own architectural meeting for architects. Why is that? Why is it extremely misleading? Yeah, it is like, a brother marrying a brother to produce the baby, to make a family, to make babies. What is that problem? You cannot have people in the same discipline exchanging knowledge among themselves and think they are going to be productive. It creates a problem of incestuous relationship whereby people in the same discipline gather together and exclude everybody else, and the knowledge that comes out of such meeting cannot be transformational because it is lacking input from everybody else. So you want to have an open meeting where people gather their knowledge in their own disciplines, but then they come and share with other disciplines so they can create transformational products or projects. For example, nobody will be very happy to say that he's going to have a wedding and he's marrying his sister. Yeah, even nature does not accept that, because if a brother marries his own sister, what happens to the babies they produce? They're going to have genetic problems because of problem called inbreeding. That inbreeding that you see, that a brother marrying his own sister, breeding inside your own family does not do what? Does not create healthy offsprings. So an architect just meeting with another architect to discuss architectural issues, and this architectural issues about a hospital, and this hospital requires nurses and doctors to go and work there, and technicians and all the hospital professionals. If those architects can just talk about hospital design by themselves, eventually they will build a hospital that is not suitable for doctors. And that is a tragedy. And so what we're talking about, if you want to create something good and comprehensive, there has to be intersectoral collaboration, interdisciplinary collaboration. The only reason we don't do that is because the traditional payment system is highly centralized. So everything heads towards centralization. So we're talking about decentralizing even sources of knowledge, decentralized finance, decentralizing the interdisciplinary collaboration. And that has become possible through the blockchain. Now we're able to create decentralization in knowledge generation. So the communities, you don't have one community saying that it's the one in charge of everything. Like when you have economists meeting with other economists, they have an inbreeding problem because the products they are going to create are not fit for human beings because they have genetic problems because of inbreeding. So in order to have something called robustness, you need something called genetic reassortment. Reassortment is that when you get genes from this community and then you combine them with genes from the other community so that you breed strong children who are genetically reassorted. Even bacteria and viruses know that. One bacteria that is very good at genetic reassortment, one virus, is the flu virus. Why the flu virus every year, like COVID is highly reassorted virus that can kill millions of people. Why? Because it knows the process of robustness, how to create robust offsprings that are resistant to any kind of treatment because they have never been seen. So if you want to create robust communities that can come up with solutions that are very potent, we have to think about creating a base for intersectoral, cross-sectoral collaboration, collaborating with one another, exchanging value, and create a system for exchanging value such that architects and doctors or teachers and engineers, all of them can collaborate with each other, regardless of whether of their profession, different professions. And that's how we bring communities together. And so Actuate Token now, if you come from that perspective, we see that the communities we're talking about is not just community health, as the people of different villages living in different communities. We are talking about community people exchanging value with one another. And that's what the blockchain has managed to do. Yes. And the blockchains are now, you see, is in Web 2, we had communities forming, exchanging information, things like Twitter, all that, and LinkedIn and Facebook. But they were exchanging information, but they were not exchanging value. They were not getting paid to exchange that information. So what you're talking about is the Actuate token now comes in, and whatever exchanges are going to be happening, remember it's about exchanging value. Exchanging value. Whatever exchange is going to be happening, it gets rewarded in form of money. The money is the blockchain money, the Actuate token. So I hope we have understood that this is a very, These are philosophical ideas about what is community, what is money. As I told you now, eventually to conclude that money is a system of symbols and agreements. Symbols and agreements for exchanging value. Whatever value you do, you need a symbol to represent that value, and that is actual token. And that is what you need to build a community of value. And these communities of value, they are interdisciplinary or cross-sectoral communities. And that is what is exemplified by the Actuate summit coming in this December. So you come to the summit and you're going to see how this is going to be playing out. But let me stop talking a lot more so that you can give other people to speak. And it's back to you, Glory.
Thank you, Daktari, for those wise comments. Yeah, we have really learned and understood what community health really is, and how we can now leverage our token to promote health of the overall health of a community. And you have heard what a community really is. So now I will welcome questions or opinions. You can direct them through the chat box. And meanwhile, we will, as Daktari has said, that we have a cross-sectoral interdisciplinary summit where now people from different sectors will come to exchange ideas so that we get the robustness that Daktari is talking about. So I will welcome Augustine to give us the Nairobi Pre-Boston Summit. Augustine, well, you're welcome.
Hi everyone, and good evening. I hope you're all doing well, and thank you so much again for making time to this Actuate Health Access Learn to Earn session this week. And thank you so much, Anthony, for that powerful presentation about enhancing community health using Actuate token. So as Glory and also Doc has mentioned about the summit, the Actuate Pre-Boston Nairobi Summit, and it's a multidisciplinary summit focusing on facilitating idea sharing and collaboration from various disciplines on how we can improve health and human development by leveraging these technologies such as artificial intelligence and blockchain technology. So this summit is aiming to bring together all these stakeholders, all these disciplines, people, companies, organizations, to come and see what future do we need in healthcare and human development, and where are we, and what can these technologies do for us to get to that future. So it's gonna be a 3-day summit from 3rd to 6th December this year, and it will be at Kenyatta University, those who don't know by now. And yeah, and I just want to say that there will be various things going on, parallel workshops, and we are not leaving behind health access workshops. Yeah. talking about health access from every angle, from economics of the patient to solving distant barriers, to solving even time barriers in terms of accessing health. So that workshop will be there. So we are trying to close that because we have various people who have potential and have that capacity of running health access. But I think in few time to come, we will have clear of who will do that, okay? And we will be able to discuss all the things about the health access. Where do we need to go? Where are we? What are the challenges and what can we do, you know? Also, there is an opportunity at the summit for poster presentation. And I would love to give a hint, okay? Because the theme is using artificial intelligence, blockchain technology, and decentralized finance to improve health and human development. I'm just giving hint about for those who are interested in poster presentation to come up with a topic about how we can leverage these three technologies to improve health access, okay? Either distance issue, either time issue, either affordability issue, that is economics of the patient, or the interaction of the three technologies. They must interact at the end of the day to deliver health access solution, okay? So it's good. Information is there, sources are there, research sources are there, tools. We are really a blessed generation, okay? So let's learn. And at the moment we are good, our learning curve is good. Generate something and then register with us as a poster presenter. Or even you might be already running a project about this, so you're in the right platform, okay, for you to showcase. And who knows, you know, you might it might be a life changer, you know, some shift just occur. Okay, so let's think that way deeply, because when you talk about health and human development, when you look at all our projects from environmental health up to health access, STEM, all the things, they are revolving around human and health development. Okay, so Actuate is don't say that we are coming with different things. We are all over. Okay, so whatever we are doing here, coming here every day to discuss, it will be covered. So choose anything you are going to learn in either human development impact or health development impact. Okay. The other thing is now exhibition. If you want to showcase your innovation, there is a space for you. Tell other people, your networks, that there is an exhibition. Spread the word, share the link about the exhibition booth, and we are going to ensure that even those who exhibit will get the products. There's some promotion in terms of people, attendees interacting, and even buying to promote them during that time. Okay, so it's gonna be amazing. It's gonna be big. Please, okay, be part of this. Do something today. Share it. Okay, share it within your network, your relatives, those you know who are aligning, who are into tech or even health or human development, even businesses. Okay, let's connect the dots and then do something. Invite them, spread the word about the exhibition. of course, there will be attendees, no summit without attendees. So exhibition, we're charging $1,000. So if you go there, in our website, you will see, okay, you will see the registration link and the fee, the charging, and the process of paying and confirmation and all that. Attendees also will be charged $150. Okay, so spread the word about attendees. You can be one of them. But if you do great work in terms of other avenues, and then also we perform, who knows? Yeah, we can even pay your ticket from Kitale to Nairobi. You don't know. Okay, so don't worry. Other categories are sponsors. Okay, we are looking for sponsors. We are partnering. We are continuing reaching out to people reaching out to us. Okay, summit is getting interesting. People are starting to, want to know more. Okay, because this is one of the summit that doesn't have to, someone can't afford to miss. Yeah. Yes. So I think you're privileged to get to be part of this and hear this daily. There's some people who just hear it once and be like, okay, is it done? Are you guys closing? No, we are not closing. Even on 2nd December, we can't close and still take you. Okay. So it's getting interesting. People are getting, it's now that time of, people are entering the savannah. Is it the savannah or the Noah? What was that? The ark. Yeah, not savannah. Sorry, guys. So people are entering the ark. Okay, yes, people are entering the ark. So don't be left out. Don't be left out. So that is sponsorship, and we have various packages. We have title sponsor, which is going at $100,000. We have diamond package, which is going at $10,000. We have platinum, which is going at $7,500. We have gold, which is going at $5,000, and we have silver package, which is going at $3,000, and bronze package, which is going at $1,000. Okay, so those are the packages you can present to potential people, and then now from there we can move forward. And we are here. Just tell me where you're landing this week. I can accompany you, see what goes on, how you're trying to say. We move that way, okay? That is the role of blockchain. Blockchain is to bring equality. So we don't have ladders. We don't have levels here. We work with everybody. So if just beat me around Nairobi, you want to go somewhere, let's work. Okay, let's go there. Let's make this thing known. There's so many disbeliefs, fake news around blockchain, but it really holds immense potential to liberate us both economically and even social wise. So we are going to push this a journey, and we are all proud to be part of this pioneering journey or initiative initiated by us to us by none other than Dr. Macharia, our CEO. We are so much grateful in this pioneering initiative to set us free as a continent. So you should be grateful and clap for yourself for being here and hearing this great news of amazing news of how we are trying to push moving over boundaries to set healthcare free and even economic development. So so anything else? I feel like I didn't mention, maybe Doc will see something, but we are really learning. We are doing great. A lot of partnerships taking place. Yeah, so do that. There's that challenge. You see, sponsorship challenge is still on. You invite a sponsor, 5%, you receive 5% commission of the package that you sold. Okay, so yeah, try. Who knows? Okay, yes. So that is it, and back to you, Glory.
Thank you, Augustine, for that comprehensive announcement about the summit. So as you have heard, how you can participate in getting the sponsors, exhibitors, and Augustine has highlighted the benefits for each, and I will emphasize on poster presentation. So we will have that chance for poster presentation, whereby you will come up with an innovative idea about you see you have experienced someone else face barriers as they try to get medical services. You have been a victim one time, and also since we started this program from level 1, level 2, level 3, now we are at level 3, and you've acquired so much knowledge. I think you are at your PhD level now. We have confirmed you the first, second degree, because a degree is what you have. It's what you have. It's not the paper. It's what you've acquired at the end of the day, and with so much knowledge about the challenges faced in health access, in healthcare delivery in Kenya, in your village, in your community, in Kenya, in your country, and in Africa. So you brainstorm, sit down, reflect all that we have covered, and reflect and brainstorm how you can now align with the theme of the summit, which is using AI, blockchain, and DeFi to improve health and human development. And of course, the best poster will be awarded. And you never know, maybe this is your time. And getting such an opportunity, it's so rare. You all know, getting such a platform to showcase what you have here in Kenya, it's very hard. You have to pay a lot of money. And here, for the poster presenters, you're presenting for free. You know, sometimes people like, you don't take free things, so like you don't value them. And I can assure you, this is a golden opportunity for you. Let's value it, let's treasure it, and let's take it serious. Before December, make sure before the applications are still ongoing, make sure you apply and work on it. Give it your all, give it your best. Like, it's the only thing you have. And yeah, we become best by doing what we do best. So now I will welcome Daktari to add on that. Daktari, you're welcome.
All right, Glory, thank you. So this is about the summit. Oh, can you hear me? All right.
Yes,
okay.
yes, Daktari, we
All
can
right,
hear
I'm
you.
good. Yes, about the summit. So thank you, Glory, and thank you, Augustine. Augustine, you have told us the great news. I want to emphasize that great news. Let us emphasize the great news. The great news about this summit is that it is giving us the freedom we have always never understood. I can tell you that freedom, and as I've said before, that we got freedom, political freedom. political independence. We were told we were a free country. But then we were told that we can now rule ourselves. And I can tell you, political freedom is nothing without economic freedom. So the freedom we are talking about is economic freedom. And this, the economic freedom, without economic freedom, there's no development. And without development, there's no health. So this summit is a testament of economic freedom, which we're now able to exercise through the blockchain. So it's exercising our freedom. That's the great news, by the way. Okay? If it has not dawned upon you, what is the great news that we are talking about? The great news of economic freedom is finally here. So these freedom fighters of long time ago in the 1960s, they did a great job. They got to kick out the colonialists. But those colonialists left, but they actually never left because they never gave us the economic freedom. That's why we have so many problems with health access and even having problems with the market, because there is no economic freedom. And so there's a summit for expression of economic freedom, and the economic freedom is coming, and a lot of people are getting it. For example, yesterday we had a very fascinating call with one of the speakers, with Augustine here. I was surprised. People are actually getting it. People are calling us, confirming, is this summit still there? Yes, it is still there. Where is it going to go? It's still there. So if you have any doubt, you have no doubt, take the doubt away, because the summit is still there and it is taking place. And they are very motivated. This person who called us is a health information professional. Health information technology. So he knows everything about medical records, how we create the health records in the hospitals. And he's also a computer scientist. But they know, even in his network, they're always complaining about how we do our health record. And so they are very, very excited about this summit. Because at the end of the day, after everything is said and done, what creates the value we just talked about is how we manage the information. Not just patient information from the communities, from families, then people coming to consume health care. All that information today, what he was saying is highly fragmented. And remember, this is somebody with a lot of experience. He works in health information, and he's very excited that we are doing this. And he's very excited, even with, he said he's gonna call all the colleagues, everybody he knows, tell them we have to go to this summit in KU in December. Then he said that he graduated from KU, so he knows the amphitheater. He sees that the amphitheater can hold a lot of people. Say, let's call even 10,000 people. Say 10,000 people? Yes, you know what he proposed? We do Twitter Spaces next month in October, X Spaces, to talk about this, to talk about the great news, where we are talking about the new liberation. And he is convinced, persuaded without doubt, that the blockchain technology is the answer to the health information system. Say why? Because of course, it's secure, and of course, all the good stuff we say about the blockchain. But something else he added, that in a traditional health information system, let's say Web 2, you need to build data centers, which are very expensive, data centers to manage all their data. But the blockchain itself, you don't need to build a data center, because of the distributed ledger technology, where the data is distributed all over the world. See, that actually takes away one step, which, making a data center would cost you maybe $100 million. But imagine we're having health data secured on the blockchain without having to build a data center. You don't have to spend one shilling, because the blockchain is a distributed data set. That I had not even thought about, but I can tell you, very, very powerful. So people are asking. Somebody else was talking to today told me that, well, is Elon Musk giving you Starlink? Is Elon Musk coming there? So I told him, I've not even actually approached Elon Musk to talk to him about the summit in Nairobi, but he said that Elon Musk has got Starlink, which I know. That I saw some communication about 3 weeks ago about Starlink coming into Kenya. I don't know. So we want to get Starlink there because Starlink, I think Starlink is already in Kenya. Let's get Starlink. You see these people, this is somebody telling me randomly about that, calling me, say, yeah, we've seen the summit. We're talking about the information system. Do you have Starlink? I said, what Starlink? Yeah. So anyway, basically, to cut the long story short, is that there are people are calling and they're saying they are very excited about the summit. And they actually so much excited about the workshops themselves. As I said, the workshop is a creative process whereby we go through 3 days of profound intensive networking to create the future we truly want. When you get all those professionals, multidisciplinary professionals coming together to say, okay, how do we create the health record of the future together? How do we manage the health information together to manage health access? So then we say, look at the future, what that future looks like. And then we say, what is the current reality? Imagine the reality in the hospitals today, where most of the health records are written by pen on a paper. And then to get the health records out becomes so difficult. Prescriptions are written by hand on pen, on paper. And then once there's no record of that prescription in the hospital because the patient takes it to go and buy. You see, so they know these are current realities. And what is the problem with doing it that way when we have technology to do it? Then on the third day, we create the roadmap together to get to that future we truly want. And this was very, very exciting. And you are already in. So all you have to do make that poster, as Glory has said, and you come and we have a big festival for the future. All right. So that's just to underscore the fact that people are seeing the summit is coming very close and they are still inquiring when do we come in? Are we still there? And so wait for that announcement for the Twitter Spaces. So this gentleman said that he's going to invite a lot of people in his network. So this is not somebody inside Actuate right now. Somebody outside saying he's going to invite a lot to the Twitter Spaces so we can start preparing their mind to be at the summit in December. So that's going to be happening in the next 2 weeks for the Twitter Spaces conversation. We have a video, and please post it to the video on the network, the profound networking. That video on the nature of the workshop. So watch that video carefully so you can understand it, because it's very powerful process where people create the future together. So be prepared to come and create the future and with everyone else. So we become a community of future builders and as futurists. And that future is here with us, the present. Okay, so or presencing the future, or bringing to the present the future we truly want. Have you heard of that? Bringing to the present the future we truly want. Bringing to the present the future we truly want. That technology is known as presensing. Yeah, I know it's coming from the Presensing Institute in Boston, Massachusetts. Bringing to the present the future we truly want. That's what we're going to be doing on that at the summit for the 3 days. And the 4th day is bring it all together for everybody. Okay, thank you so much, Glory, and back to you.
Thank you so much, Dr. Ari, for those powerful remarks. Yeah, let's strive, join us, all of you, as we strive to bring to the present the future we want. I think, yeah, That's so, Daktari.
That is Otto Schama. For if you want more, that's known as a theory U. U, the bringing to the present the future you truly want, is known as theory U, written by Otto Schama. Otto Schama is the founding chairman of the Presencing Institute at Massachusetts MIT School of. So just Google that. Presencing Institute, theory U. I think we should all one day unpack theory U, because this is theory U is our guiding principle, bringing to the present the future we truly want. Okay. Well, in the Holy Bible, they call it the kingdom of God. It's the same thing. Or bringing the new heaven into the new earth, like in Revelation 21. But now it comes to organizational science, we call it presencing. You see how people have raided the Bible to create their own new way of doing things, but the same thing, bringing to the present the future we truly want. It's presencing. Okay, that's it. Glory.
Wow, the theory seems interesting. I will dive deeper. Yeah, so thank you, Daktari, once again. Thank you to our topic master, Ronald, for powerful presentation. Thank you all for joining. Let's participate, as you have heard from Augustine and Daktari. Let's all work together. Let's cooperate to free ourselves. Yes, so let's keep joining our sessions every Thursday at a time like now, from 8 to 9, and let's work towards making the summit success. Let's all participate. Yeah, so the attendance form has been shared on the chat box. You can fill, and once you fill, you are free to join. Next meeting, we will learn more about the importance of our Actuate token in global health. Yes, so tag along your friends, your colleagues. It will be an enlightening session. So unless there is any other concern, once you fill the Google form, you are free to leave.
All right, thank you so much, everybody.